Hello, and thank you for attending today's webinar, Beyond the Hype, Achieving Real ROI with AI and Claims Automation, presented by ABBYY, Naviant, and Fierce Healthcare. I'm Kelly Hogan, conference producer with Fierce, and I'll be your moderator for today. But before we begin, just a few quick housekeeping items. In just a moment, you'll meet our panelists, but you may also learn more about each of them using the Speaker Bios panel on your screen. Similarly, I encourage each of you to explore the Handouts panel for more information about ABBYY and Naviant's white paper, which further explores today's topic. If one of those panels does close, simply click the name in the top navigation bar to reopen it. This webinar is being recorded and will be available on demand within 24 hours. And finally, there will be time for a few audience questions at the end of the session. If you do have any questions for our speakers, please enter them in the Submit Questions panel at any time. Now, I would like to welcome our speakers and give each of you a moment to introduce themselves. Please let the audience know a little bit about yourself. Sushma.
Hello, everyone. This is Sushma Akanuru. I am the Senior Vice President, CIO at Independence Blue Cross. We are Philadelphia's largest health insurance company, as well as the trusted partner when it comes to really making sure you have your health journey covered and your health outcomes in good hands. I'm proud to be talking today with all of you about AI, not just specifically around claims, but just generally how AI is changing the way Independence thinks about improving our operations as well as serving our members.
Excellent. Mark, would you like to go next?
Sure. Thank you, Kelly. Mark Miller, Senior Vice President at Naviant. And for more than 20 years, I've helped leaders identify ways to manage the constant pressure they have to do more with less and lower their costs in this ever-evolving competitive landscape. And so I do that through strategic planning and execution of value-driven automation. So our customers are payers that are looking to figure out how to tackle the use of agentic AI to make sure that they're recognizing value throughout their organization. Thank you.
Wonderful. Welcome. And Bruce.
Thanks, Kelly. I'm excited to be here. So my name is Bruce Orcutt. I'm the Chief Marketing Officer at ABBYY. We're a company that puts your information to work. We focus on transforming enterprise documents and data into structured information to help you automate and accelerate any of your business processes. And I've been at ABBYY for 15 years and looking forward to our session today.
Wonderful. Thank you to all three of you for being here. Let's go ahead and begin our discussion. So Sushma, I'd like to begin with a question for you. Just to level set, what are the biggest operational pain points in claims management that are pushing the industry to explore AI-driven automation? What finally has made this business case unavoidable, in your opinion?
Yeah. Kelly, I would say I always start when we talk about claims, I look at claims as this primary token of trust, right, between members and providers and payers, and members and payers. So if you think about the three stakeholders in sort of the healthcare ecosystem, a claim is that single unit that measures the interaction as well as trust that the parties have on each other. So getting it right is very, very important. And getting it right starts with how it's determined that, an interaction turns into a claim, how it passes through many, many, sort of links in the chain, and eventually becomes a message to a member that we've got you covered. Like we've taken care of you, your service, your health is in good hands. But what you need to worry most is really your well-being, and not so much whether the administrative aspects of that interaction are stuck in a loop or not closed, right? So I always look at this from a consumer's lens. And then ask yourself, if you go through that journey, whether it's general wellness visits to a, emergency incident, you want to make sure that interaction goes through pipes that are not clogged. You don't want too much of a handshake, human handshake. You don't want uncertainty. You want it to be very clean, fast, and predictable. And from a member's perspective, you want transparency, right? So a lot of use cases where it may feel like, well, a claim is denied, but we couldn't explain it to the members, and there's no real ROI because members are not kind of paying for explanation of a denied claim, is not the way to go. Like that, I think we've turned the page from looking at claims as a pure administrative function to turning that into, like I mentioned, a way of gaining trust from members and group clients, especially from an independence perspective. It matters that we deliver to our group employers that level of trust with every member, every claim. So I would say, to answer your question, there are opportunities in how we ingest claims, like in the EDI space, in the area where we interpret and translate that into a token that systems can process. So it's in the core adjudication platform. There's a lot of opportunity to sort of take some of these human discretion processes and convert them into systemic, intelligent, predictive processing, as well as then how do you relay that information back to all of the downstream, including the members, but not limited to, right? With Medicare, you want to make sure you're tying that to CMS, you're tying that to other regulatory entities in terms of reconciliation and quality control. So I would say there's plenty of opportunity when you think about AI and claims.
Excellent. Mark, I saw you nodding your head. Anything to add there?
Just, and you'll hear me talk about this throughout today. Just the member satisfaction, I think, is key. But maybe the second part of your question was, what's made the need to make changes unavoidable, the business case unavoidable. And I think really what it comes down to is competition. The consumer still has decisions that they can make, and making sure that that member experience is as strong as possible to maintain them as a long-term customer is critical to ultimate success. So that's one thing I continue to hear.
Wonderful. Bruce, anything to add?
No, I think that was wonderful. I'm really going to hook on to that token of trust statement by Sushma. That's a great way to describe the relationship. I really appreciated that.
Wonderful. Well, I do have a question for you, Bruce. Many payers have experimented with general AI and have been disappointed. From your experience, where do these tools most often fall short in claims automation, and what fundamentally differentiates purpose-built AI for healthcare?
It's an interesting question, Kelly, because we know every customer we talk to is already experimenting or playing with Gen AI and seeing the art of the possible that those amazing tools and technology can deliver. One of the challenges, though, because to what Sushma was saying, was this level of trust and expectations and accuracy and predictability is so important that we see, especially in claims, it has to be 100%. It can't just be a guess. And we see with hallucinations and Gen AI, we see many times challenges where you have one claim document, it may give you, if you run it through 10 times, it may give you 10 different answers, which now brings a level of distrust from our token of trust. So with Gen AI, everybody loves the art of the possible, but we like to highly optimize our AI models and our what we call purpose-built AI, which are really a focused smaller model, which is really focused around this task of getting the data right predictably and accurately so that we can automate and accelerate as much of the claims process as possible to, again, to bring what Mark said, bring the trust, the customer experience, and the satisfaction. So Gen AI has a lot of possibilities, but there is some risk with it as well. And we've seen hallucinations where the Gen AI will take information from another patient's record and bring it into the current document, thinking that was accurate. So that's a challenge. Of course, nobody wants bad data. And then more importantly is the controlling of the costs. We see that as the number one issue that people notice right off the bat is the unpredictability and controlling the costs has been a challenge. So while Gen AI, we love it and there's a lot of opportunity, having a purpose-built, focused, small model that's really focused around automating that claims adjudication is really what we think is the best step today.
Wonderful, thank you. And Mark, looking at ROI as a headline promise, but also the biggest source of skepticism, what are the most reliable metrics payers should use to measure real ROI in claims automation, and how quickly are leading organizations seeing returns?
Great question. Appreciate that. And really, lowered cost is the pressure that we're all feeling, no matter what business you're in right now. How do we how do we remove the costs associated with maybe some of those mundane tasks where we can use technology and automation further? So ultimately, as I mentioned before, improvements are really focused on increasing that member satisfaction. So we're always thinking about the member. As a consumer, I have certain expectations with a level of automation, and that's increasing on a daily basis. But back to the question specifically, when we think about ROI, I really think about three different areas, really: the ingestion of documents, extraction of data, and that ultimate adjudication of the claim. So how do we ingest the claims faster? It's funny, I'm actively working with a payer right now that has 40 people that are manually sorting paper claims so that they can become more efficient when it comes to scanning that document into their system. So that's really not an uncommon story, as you might be surprised by. Let's let technology ingest those documents to eliminate that type of manual step. And in that case, automation is going to reduce costs for that payer by over $1.5 million annually. So then the next one is really the extraction of data. Claims have hundreds of pieces of information that are needed. And as Shushma mentioned before, that trust means we've got to get that correct. But again, this is really a very manual process to key and index that data and information. Let's let technology do that. So because purpose-built AI accelerators that are built today are really going to automate like 95% or more of that process right out of the box. So what would a reduction of 95% of that data entry mean to your bottom line, obviously, right? And then speeding up the adjudication of the claim. How do we automate the conversion of that data and that EDI transaction to be pulled into the different claim systems downstream, all aligned with acceleration overall?
Wonderful. Sushma, any reactions to either Bruce or Mark's comments?
Yeah, Mark, well said. And if I may just add one more use case that's emerging, right? If you think about the number of people and amount of time spent in just going back and saying, why did a claim go through what it went through? Or why did it fail? Why was it approved? Why do I believe for procedure A, I should have been billed X dollars, but it feels like the claim got mixed up with something and became Y dollars, right? It is fascinating to see how much, to Mark's point, just being able to tap into the various sources and come up with a very, easily digestible explanation of what happened and what can be done in terms of next best actions. AI is a fantastic tool. Like that is where you would be condensing hours and days of work and, set large teams. And we've heard about offshoring in the past. That's a phenomenon. Like when we wanted to reduce costs, we would say, hey, instead of highly specialized staff here, on site, let's just offshore this capability to some, cost effective location. But AI is doing it in minutes, right? So here's an opportunity for us to think about how do we leverage, and especially for independents, I can tell you, I've asked like my technology team, we challenged ourselves to say anything that requires people to go digging behind answers, let's start using AI as that personal consultant that'll go do that work for you. And one application is really supplying, hey, for this member X, for claim Y, can you tell me what happened? That's all you have to ask. And you get the full sort of gist of this is when the member submitted. Part of that is paper claim, but it also came through another source or channel. We've married these two and looks like your benefits changed midterm. And hence, here's an explanation you could give to the member. And, oh, by the way, the member also called three days ago. Make sure you call back and whatever, right? Explain that this is taken care. Like that's fascinating. Like it would have taken a village for us to stitch that. AI is doing it in minutes now.
Kelly, I'll just add to that for a moment, if you don't mind. You're exactly right, Shushma. And I think, payment integrity is a great area to look at for prior authorization, aligning with the claims as well. And then that medical review process,
Right.
you oftentimes have an attachment of, a 200-page medical record that takes nurses, hours to review. And we can use AI to speed that process up dramatically. So just a couple of other use cases. I know we're focused on claims today, but there's lots of use cases here,
They're all
obviously.
connected, so you can't talk about one without
Right.
referencing the other.
You got it.
So, Sushma, manual intervention remains one of the largest cost drivers in claims operations. Which part of the claims lifecycle are best suited for automation today, and where does human oversight still add the most value?
Yeah. No, it's a great question because I come from banking. I worked for Bank of America for 15 years before I came to healthcare. So every process I try to solve in healthcare, I try to draw analogies with banking. And if you can think about, can you imagine a world where if you didn't have to go to the branch, right? Like brick and mortar, take a slip and say, I'd like to deposit $100, or hey, I'd like to draw money from the bank. You're able to do that in minutes at your convenience from your mobile phone. So first of all, like just claims intake, we've come a long way, but there is still an opportunity for us to move away from having to have members track receipts or have a provider submit like paper. In fact, I have recently been in conversations where people are even questioning the existence of EDI, right? This may take another decade or a couple of years at least to rethink that process, but the traditional ways of just taking in claims and understanding how a provider served a member seems to be an area of opportunity. So that's one, I would say. And then when we receive all the claims, there seems to be a lot of time spent on QA, right? Did the provider submit the right data? Was it supposed to be X versus Y? Can we marry that against sort of what was the member actually eligible and look against sort of the benefit plans that members or individuals are signed up for? That seems to be heavily manual in many organizations, which also alarmed me when I first started thinking about, wait, so what if there was a universal standard of how to marry these and ingest claims in a way that everything would be straight through processing versus it seems like we have a 30-day buffer, which became sort of acceptable. As a consumer, I challenged that and said, if I visited a doctor in the morning, wouldn't it be nice to sort of get real-time updates as to, hey, this is what you were charged, this is how much you should anticipate, like cost transparency, and then maybe within 48 hours, I know that everything's settled because I know I can pay it from my phone. So there is that, landscape, if you will, where there are some very disruptive solutions and AI is promising speeding up that process. And Independence is very actively exploring that. The other area I would say is, again, I mentioned a little bit of that, just inquiries, right? What happened to a claim? Like, tell me which phase of the life cycle is the claim stuck? Whether it's large claims adjudication platforms or ancillary systems that can sit on top of them. There is an opportunity because we know the data sources, we know the claim is flowing through these steps, and we are able to pull insight without doing traditionally we would have to sort of stage sort of tracking and audit logs and write a complicated application to say, hey, the claim is moving through this life cycle. AI is doing that in minutes again, right? It's able to sort of go into, as long as you can hook up to your earlier question, what will it take in terms of prep? The preparation really is data sources are clean, searchable, right? Your data is cataloged in a way that AI can easily go and sort of pull from various sources. As long as individual organizations can do that homework, right? Put your data on the cloud, make it accessible. I think AI can do the remaining. So those are the three areas that come to my mind, and there are plenty of other examples as we go through this conversation. I'm happy to share.
Thank you, Sushma. Bruce, any thoughts on what Sushma has shared?
No, I thought her analogy with banking was rather spot on because patients and consumers now have an expectation of now. So her analogy of going to having a treatment and then knowing what your reimbursement will be. That's what customers expect or your patients expect. So that is how we need to be architecting, delivering these systems, because quite frankly, the technology is there for us to embrace improvements to be able to meet that expectation. So, and I celebrate that. I think that's what's going to drive a lot of the innovation, is the ability to meet these patients and customers where they are with the right
Right.
level of decisions and answers to them.
Thank you. And Mark, accuracy is a major benchmark, especially when we talk about exceeding 90%. What operational data or workflow changes are necessary to reach that level of consistency, and how much of that success depends on technology versus process redesign?
Yeah, great question. And I think about this a couple different ways. But first, I'm going to tackle it with accuracy. And really, lots of folks will say, "Hey, I need to have 99% accuracy coming out of my solutions, right?" And really, the technology that they're using. And when it comes to data capture in a document, traditional methods of OCR are going to tout 99% accuracy at the character level. In reality, every type of OCR technology that's out there today is going to give you that level of character accuracy. You're more concerned with the overall capture at the field level. That's ultimately going to give you the opportunity to achieve that straight through processing that Shushma identified before, a scenario where no human intervention is really needed to adjudicate that claim. And still there's humans in the loop today that are going to be used until really the accuracy for straight through processing is trusted on a more consistent basis. But that's moving and accelerating very quickly right now. But back to the question, really, success is measured with a number of different factors. It's a combination of being flexible enough to make operational changes in conjunction with the data needed to attain certainty that the content captured is correct. And Shushma also identified, having clean data is really critical. An example might be you've indexed the data you need off of a document, but let's say we're going to let automation now verify that member data from your database and normalize it. Let's let technology do that rather than people. Or let's let it validate and normalize the NPI data for the provider, right? If something doesn't match or is really in question with the quality of the document, then we're going to send that to a human to confirm. So having clean data from these sources in conjunction with your standard business rules for handling claims is really critical. So our teams are focused on handling, those exceptions then, rather than manually indexing and looking up member or other data for validation, if that makes sense.
It does. Sushma, any thoughts on how that fits in with what your team is working on?
No, I think that Mark has really laid it out well. Like I mentioned, there is an opportunity to think about future state of data versus current state data. I talk to my teams, a lot of AI examples that they hear in the market are taking some traditional process, right, that either was attempted to be solved by traditional RPA kind of bots. And then, hey, we've asked AI to do exactly that. And, here's the output, it's working awesome. And then you sort of get into this, let's challenge the solution itself. If we were to build it for like 2 generations later, right? If this was part of a Star Trek program, do you think they'll accept this kind of a process? And then they're like, aha, we could have just done it some other way, right? One example would be creating sort of data lakes and sandbox and layers of data, index data and RAGs on top of the source data, while AI is moving so fast that all you have to tell is, go to my membership table, it's sitting on Google Cloud, and also marry that with, maybe I have a couple of SQL databases with, claims information that is staged. And then I also advise it, by the way, tickets or incidents that come from members are sitting in a platform like ServiceNow or Salesforce. Make sure you go there and look for what's happening about Sushma Kunuru, and tell me what's going on. That's all you have to say, and let AI do the work, versus this presumption that I got to pull data, I have to curate it, pre-position it in a way that is then accessible. Like, a lot of energy was being spent on that, which I think can be avoided with how AI is evolving.
Interesting. It really is a fascinating thing to witness, the evolution. Bruce, I would like to send it back over to you and talk specifically about intelligent document processing. How does intelligent document processing handle variability across forms like CMS 1500 and UB04 while still maintaining standardization for EDI 837 mapping?
Yeah, so that's a good question because, at ABBYY, we process tens of billions of pages a year of documents for our customers. They could be contracts or, identity documents and utility bills, all kinds of really complex stuff. But the CMS 1500s are some of the more difficult because of their variants and the different types of data that contained within them. So they're highly, highly challenging. And so we work with partners like Mark to really build the best models to be able to understand that context, that relevance, and to give out a high level of precision. But what IDP is about, what intelligent document processing is about, is transforming all that data locked within a document, irrespective of where it came from and what it is. Could be correspondence, it could be a structured form, it could be a CMS 1500, and then transforming that into highly precise structured data, so that way we can automate and accelerate that whole transaction. And to Sushma's point, the more we know and more data sources we connect to and the AI is engaged, the much more better you can enrich this data. And we see a lot of tremendous things happening by combining IDP with agentic approaches, bringing, help making those decisions straight through and giving comfortable or confident output. So it's really an exciting time for what we do on the document side, combined with the automation that Mark brings to bear.
Mark, anything to add?
No, it's funny. You talk about standardization for, the EDI 837 mapping in there as well. And it's funny, there is a standard, but not a single one of our customers follows the standard exactly the same way. So being able to be flexible enough to modify to the standard and maybe a specific standard for those customers, I think is critical as well too, just to make sure you can ease the process for getting that data into the adjudication system that much faster.
So the standard is not quite standardized, is what you're
Yeah,
saying.
not really. Close.
Yeah. Well, Sushma, coming back to you, many payers are operating with legacy core systems. How do you approach integrating AI-driven IDP into existing claims platforms without creating new technical debt?
Yeah, I'll tell you this. I'm fortunate not to have to solve that problem anymore because we've chosen a good technology, modern platform with, as probably is well-known news that we leverage Health Edge and their sort of claims platform in the ecosystem. And recently, Independence has gone through this platform migration where we've modernized a lot of touch points with that core platform. So I feel the one thing is for sure, the success of a payer will absolutely depend on how they make these thoughtful choices between buy and build. And, again, you have to be pragmatic about where you don't have to reinvent core systems, which is not necessarily, a payer strength, but very pivotal to the success of our business. So I think those choices have been made, and we feel good about how documents are processed. One thing I will also say that the starting guiding principle should be minimize document at the first place, right? So to my earlier analogy, paper claim submissions still seems to be a phenomena. Like we should pivot and change sort of the market dynamics and the mindset of our stakeholders to even move away from having to use paper. Now, paper has its purpose, right? My 70-year-old mom still feels when she shops at ShopRite, she loves to take that paper home and just look at it. That's great. But like you can always sort of subscribe to paper and email, right? It's always there for the record. I still feel like there is this inertia to move away from paper. But there are other places like charts, right? We always have complicated charts to look at, and our informatics department does a fantastic job sort of going through, applying AI to go through complicated unstructured data to marry that to proving either a prior auth or marrying that with a claims approval process. So I cannot emphasize the need for that shift in moving away from traditional ways of operating, but also when we think about modernized platforms, really the application of AI in managing documents versus the traditional OCR only, the NLP only, all by itself will not sort of serve the purpose. They all have to really come together.
Thank you. Mark or Bruce, anything maybe to add for any of your customers that have implemented any words of wisdom?
Yeah, I think the buy versus build is interesting because, yes, traditionally in the insurance space, it was, AS400 mainframe core applications that were there. And candidly, technology is moving much, much faster nowadays than now. Nothing wrong with those systems, very stable, but it took a special approach to develop those things, and you had complete flexibility. But now you're losing the potential for speed to market, speed to accelerate, automation with other out-of-the-box solutions. So I think the pendulum has definitely swung towards the buy direction, and that's what I'm hearing from our customers as well. We have this continual pressure to increase the velocity at which we can process claims, and we just can't build these solutions and support them long term. So I'm going to go look to technologies that have long-term stable experience working in the marketplace, and that's where I see most of our customers moving now.
Thank you. Bruce, I wanted to send a question over to you again. Compliance and audibility are non-negotiable for payers. How should organizations evaluate whether an AI solution truly meets regulatory, privacy, and audit requirements rather than simply claiming it does?
Well, that's the benefit we have by working with people like Sushma, because she's never going to let something go through that hasn't been thoroughly vetted, tested, audited, and meets all the compliance standards and things. So it has come from trust from the ground up. You cannot go to market and deploy a solution today using AI that's making decisions that will impact confidentiality, patient success, impact revenue, reputation, and brand. It's really challenging. So you really have to have those right gates put into the platforms and systems. We have customers that use much of our technology for model risk management. So while we're using AI to automate and accelerate these processes, we're also monitoring the AI and the decisions it makes to make sure we're not drifting or creating new problems or unexpected problems or behaviors. But compliance is the most important. You have to have trust and faith in everything that's going on and how it's delivering. And so if you don't have that, then it's just going to be really, really difficult. And no one wants to wake up seeing their patients impacted or seeing their brand impacted because of mistakes that AI or technology made. So the aspect of compliance is super, super critical. And everybody, at least I know in the insurance and banking space, puts that front and center. So that's why we haven't seen any of these big challenges that you've seen with some of the legal stories in the market of people using AI to generate certain content, and it ends up being completely wrong. So
thank you.
If I were to just add the one thing that keeps going on my head these days as we talk about responsible AI, right? AI toll gates, and talk about your use case before it's deployed, even before you envision the use case. Talk to a bunch of legal compliance risk experts to tell them how this AI solution will not fail or will not go wrong. I think there's a fine balance, right? More than ever, you should trust but verify. So be very sure that you can build not just the automation with AI, but the verification tools and the solutions around it that will become self-guarding, right? So there is that. And then there's a balance of you can't be too cautious that you don't innovate at all, right? You just all talk and no outcome based. You can deliver. You have all of these POCs that are stuck in the permission queue. So I think it's a very fine balance, and again, very promising to see 2025 or early 2025 was the year of all of these proof of concepts and sandbox experiments. At least from Independence, I can say that by end of 2025, we were able to actually move a lot of these ideas to production and, actually scale them at in a larger scope and scale this year. So, and I speak for most of the Blues. I'm very intrigued and inspired by how at least payers are not hesitating. Unlike, the myth about, hey, banking is ahead, healthcare is behind, like healthcare doesn't take risks. I think we're changing the game a little bit.
That's amazing to hear. Thank you for sharing that, Sushma. Mark, change management is often a hidden barrier to success. What organizational or cultural challenges arise when introducing AI into claims teams, and how can payers proactively address them?
This might be the most important question as I think about using automation in organizations, because as humans, we like predictable processes in our life. Think about your morning. If your routine is like mine, I'm a coffee drinker, and if I do not get my coffee in the morning, how do you feel about it? I feel terrible, but change management is really the key to, I think, any successful automation effort. I've said this many times. Technology is actually the easy part. It's the people that are the hardest. And our most successful customers use formalized change management processes to ensure that change is successful throughout the organization. And it really starts at the top. Executive leadership builds a story for why is this change necessary? And then this story has to be shared and told many times, often in group settings and individual meetings, just to make sure that everyone is heard and has an opportunity to express their opinion. And I've talked to many executives who have had to basically tell that change story 100 times to make sure that the why message is heard. But commonly, the other thing that we hear is, hey, AI is going to take my job. But in reality, AI is going to take away those mundane, boring parts of your job so that you can focus on the more important tasks that require a human brain. So that's going to make your work more valuable and more rewarding as someone that's in that organization too.
I've certainly heard that across different industries, across different job functions. What is this going to do to my career, my role? So thank you for, offering that. I think that's a really good way of looking at it. It's going to free up for that innovation. That's wonderful. And kind of staying with you, Mark, we're seeing growing urgency with many payers planning automation investments in the next 6 months. What risks do organizations face if they delay? And what advantages are early adopters already realizing?
Great question, and I'd love to hear from Sushma on some of the things that they ran through a POC and have been able to implement as of late. But for me, it's a double-edged sword, right? We are seeing this daily in the daily news, AI and agentic automation. It's a super hot topic. Lots of leaders feel like I've got to adopt AI of some type now just because I've got this fear of missing the wave of falling behind. And a certain part of that does exist, right? But a recent MIT report on the state of AI in business for 2025 focused on the Gen AI divide, which indicated that global enterprise investment in generative AI surged to somewhere between 30 and 40 billion dollars, and the vast majority of that capital has been just incinerated without any type of return. 95% of those investments weren't seeing any return because they're misaligned with true value. They're trying to deploy AI before they've proven that the technology is going to actually bring value to it because of that fear of missing out. So here's how we kind of solve for that, or how I think about it is, let's take time to make sure that you've got your governance aligned with the use of AI, and then build a blueprint to follow for the use of any automation, no matter where it comes from. You wouldn't build a house by just showing up with a bunch of building materials. Let's put a plan together first that's proven on value. Then let's identify the processes that are really ripe for automation and change. We've mentioned a number of them here today already. Claims is certainly one of them, prior authorization, medical review, payment integrity. Those are the ones that you want to take a look at, but make sure that you don't automate processes that might be brittle. if you don't have a strong process that's built out so far, the nuances of bringing AI can actually cause a bigger bottleneck and a bigger problem for you long term. After that, let's evaluate technologies that really have a track record of proven performance and can scale to meet your needs today and as you grow, right? So I'd rather take more of a measured approach to identifying and making sure the value is driven through the organization rather than to leap into a solution that might not be aligned with the organizational goals and then potentially take you off track as it relates to strategic direction.
Sushma, any thoughts, reactions?
No, I think that's the framework has been set. I think we've been talking about this framework for a while now, where I see sort of immediate value, and again, not just speaking for IBX, which we have been, like I mentioned, working with certain models that seem to be delivering more sort of low-hanging fruits, high value, low investment, immediate changes to be deployed without sort of having to break a bank, right? One of those is just paper claims management. There's still, like I mentioned, there's still a lot of paper claims that have to be manually entered, converted to 837s, mapped to the right member, right claim, which provider, maybe they just scribbled in unstructured formats. How do you convert that to something that systems can ingest? That's where AI is playing a big role. The second area I mentioned is claims inquiries. A lot of time is spent in tell me what this claim is about, tell me where it came from, tell me why it denied, tell me more about, whether it's a single claim or member related a portfolio of claims. That scale of analysis is what I think is an area where AI can help. And lastly, just think about prior authorizations. There's such a focus this year for every payer around prior auth and connecting that to the workflow, and when sort of requests are kind of not moving because in the process you want to map that to custom benefits, you want to map that to custom contracts you have with providers. This is a lot of work. In the past, we would rely on experts who had decades of experience working in healthcare. Only they would understand why a client is set up a certain way, or Jefferson would work slightly differently than mainline health. And all of that has been now sort of normalized because AI is able to sort of crawl through thousands of records, millions of previous claims, come up with patterns, recognize correlation, in fact, even predict before a claim arrives that, hey, you should anticipate the majority of your trend is looking towards, focus more on home host, sort of the local intra-blue arrangements versus you're doing great with your local claims. Like that level of insight you've never had before.
Fascinating. And that prior question about change management, since you have been implementing some of these solutions, any guidance for our audience on walking through that process, what you've learned related to change management?
Yeah, if I were to take a shot at that, I'll start with, it's not isolated to AI, but any solution built, you cannot approach it as a technology decision, right? It is absolutely business outcome oriented. So with that in mind, AI even more can be used for delivering that business value. Wow, how do you deliver a wow experience to your customers? How do you reduce cost for partners? So that should be your starting point, and then you backtrack from that outcome with the use of whether it's AI, traditional automation. First of all, do you need automation? Do you need intelligence, right? They're two different things. I always tell people, don't jump into, hey, we're automating this process if you give us till the end of the year. I'm like, don't automate what's already there. Just tell me how you would do this very intelligently if you were to do it all over from the scratch, right? So those are some of the places that then make us wonder, if this is not pure technology, then change management begins with thinking, what does it mean to members? What does it mean in terms of who is eventually going to use the outcome of, AI. What I ask, this $1 million question, I say people have to answer, how many ways can this go wrong? Like often we don't frame it that way because we're afraid of, like, we want to sort of work in certain guardrails of well-framed thoughts about risk management. I mean, bottom line, that's the question, right? How many ways can you go wrong with it? How many ways can you tell a wrong answer to members? How many ways can we probably fail to meet members where they are and what they are asking versus what we are, delivering? So that has to be a very thoughtful intersection of business, legal, compliance, operations, and technology, but technology definitely is not in the forefront from that perspective. And lastly, when you think about change management, I don't know if it was Mark or Bruce who made that point. A lot of ideas, a lot of can do, it looks amazing on especially consultant PowerPoint slides, but who will actually drive it to fruition? Who can actually give the, return on the investment? If you think you're going to take some big bets, sign up with some large technology players for, hey, we'll help you build 20 AI agents in 1 month, right? Well, who's signing up for the effort? Who has the who'll supply sort of the rules and the intelligence of how the AI should work? And then who'll measure it? And then, well, you built it, you measured it, it's working great. Who's going to then come back and say, well, this was the work that was being done by, humans or in another process elsewhere. Here's where the cost takeout comes from, right? Nobody's tying that back to the business outcomes really well at this point, right? That's where I would say change management in my mind should mature. We are not there, but there is a lot of opportunity to think about that.
You've already started to answer my next question.
I'm sorry.
No, that was wonderful. Perfect segue.
I promise I can't read through your mind.
No, you knew exactly where I was going, which was, what common mistakes do you observe that payers are making when selecting or deploying AI for claims processing, and how can they avoid costly missteps? I know you started to go down this path, but was there anything else that you wanted to add?
Well, Bruce or Mark, do you want to take that question, or is this routed directly to me representing the payer?
Mark, Bruce, any thoughts?
I think I addressed this a little bit briefly before that not having alignment with the strategic initiative and Sushma really identified having the business outcome and the member first being the primary focus for why something is happening, I think is really critical here.
Yeah, we see a lot of the AI teams are so excited for technology and to go chase the art of the possible that they lose track of the business. They lose track of the line of business that's sponsoring them. To really, they miss the overall objectives, and they kind of get ahead of themselves. And we see risk with that because the art of the possible looks like there's potential, you really have to make sure you protect the brand and you maintain compliance. And what we see is a lot of times the AI teams will get ahead of the business, and the business starts asking then implementation questions, support questions, and execution questions, and then you get a little bit of a blank stare. So to Sushma's point, there's so many ways to integrate this and bring this all together to deliver a high level of value. I think the most important thing is that you bring the right teams together, and be wary of the AI teams getting too far ahead, because ultimately the business and the process owners have to get in there and make it actually work.
Right.
Thank you, Bruce. And just to wrap up our initial discussion, looking ahead, what does best-in-class claims automation look like in the next, say, 2 to 3 years? How should
I think it looks a little bit like what Sushma brought up, that they started in 2025, which is, I think this point of real time is extremely important. The overall explainability, because to the point that she raised earlier, is there's so many sources of information that now can be brought into the claim system to really help adjudicate, and not only adjudicate, but also communicate back to the patient the exact decision that was made in an explainable way, an explainable fashion, or at least they can understand why decision was made or how it was impacted based upon the level of cost or the actual benefits that they have entitled to them. So having that transparency is so important. I think claims will get there. We see a lot of innovation happening in many of the other markets where straight through processing and full blown automation can actually work and be effective. And I think that way AI is moving now is we may see 2 or 3 versions of this life cycle by the time we get to 2 or 3 years from now, because that's how fast this is now moving. So a lot of excitement, and I do believe there's really great improvements on the horizon.
Mark, Sushma, anything to add to that before we move on to a little bit of Q&A with our audience?
I'm
No,
good. I thought that was great.
Bruce framed it really well.
He did, didn't he? Well, wonderful. In our remaining time here, we did have a couple questions coming in from the audience that I wanted to address with you panelists. So the first one we have is for Sushma. How do you think about build versus buy when it comes to AI capabilities and claims? What factors make purpose-built external solutions more compelling than developing internally?
Yeah, I clearly can read people's minds because I think I kind of touched on that a little bit earlier. But look, I face this question often, right? Hey, Sushma, what's your, as the CIO, what's your strategy? Are you a build or a buy organization? And I feel like it's not a question of ideology. It's not like, hey, this year we're going to be a build organization. Next year we're going to become a buy organization. I think it really depends on keeping in mind 4 factors for me, four unique levers that have to be very finely balanced. 1, risk, right? It depends on how much risk appetite you have, speed to market. Like if you really want to get to a outcome quickly, you do not always do you have the scale and the capital to invest and build a adjudication platform, let's say, right? There are tested, proven solutions out there, and you might as well leverage that. Then there is this whole scalability. Even if you build, I mean, are you in the business of maintaining, let's say, a platform, right? Or are you in the business of making sure your members get the right care at the right time, right? You have to pick and choose, and you have to say what's your strategic outlook, what's your strategy for the next few years, and align your build and buy decisions against it. And lastly, there've been always this consideration about when you depend on a vendor solution, you have to keep in mind where's the IP, right? Who has the intelligence? If the vendor brings a very unique, again, I go back to this, let's say, risk stratification vendor, right? A platform that they really mastered that, they understood the both local government rules, regulatory space that's changing, ever changing. So they've mastered that, they've embedded those nuances into the solution. You might as well leverage that vendor platform or application. You do not want to reinvent the wheel. Versus you have decisions where we have our member data, we know what benefit setups, arrangements we have with our clients. We have a portfolio of custom solutions we offer to let's say, our self-funded customers, and we understand how they are set up and why. So when most of the data is with us, depending on the solution, we want to keep the management of the solution also close to where the data is. So I would say these 4, I always use this as a compass, right? Like if you can answer these 4 questions and predominantly you feel like, nope, we're not going to sort of go down this path to reinvent, might as well try a vendor solution.
Thank you.
I might add to that, Kelly, too. I just add a little bit more what I'm hearing in the market space too, as I'm meeting with CIOs on a weekly basis too, and I think what I'm hearing is that yes, we want to gain the value of the acceleration to using a solution where someone may have an expertise in place, but to Sushma's point, then too, I want to also get some of that knowledge over to my team, so I'm not completely reliant on a vended solution, right? So helping to set up a center of excellence so that, we can help or the vendor can help, the customer then crawl, walk, and run on their own as well. So they're not completely reliant, but that's another opportunity that I hear very, very frequently is I need to get the access to the value very quickly, but then I want to make sure I can manage and own the solution myself as well long term.
Thank you. And then our next question, we'll send it over to Bruce. Beyond first year cost reduction, how do you ensure automation investments continue delivering value over time as regulations, volumes, and data complexity evolve?
That's a good question because it's funny. Well, we all get measured against the ROI. Many in this space, especially in healthcare and insurance, have automated as much as they can, and now they're looking at new ways to reduce those costs or remove costs. Well, we see what keeps these systems sticky and growing is the intangibles related to like revenue acceleration or expansion or customer success and growth of the patients and reducing the churn of patient care is really important going forward. So, well, we always measure and celebrate the ability to control costs and reduce costs and get a nice return for that business investment. Ultimately, a lot of the AI technology we're bringing to bear is really impacting other parts of the business that are very highly manageable and impactful, related to care, related to satisfaction, and related to expansion of that patient community, where you don't have to be replacing patients that are frustrated or annoyed by how long a claim took or what was actually covered versus not covered, or that explaining that. We see a lot of value in those investments, and so it's really beyond just the controlling the costs. It's really about that experience and delivering those at a business benefits and gains for the provider. So that's all. It's really an exciting time.
Excellent, thank you. And then our next question for Sushma, as a regional blue plan operating in a competitive market, how do you see AI-driven claims automation influencing long-term competitive differentiation?
Yeah, I think this is a great question that can recap what I've said in the last few minutes, right? Claims cannot be and looked at as a core administrative function. It is not just, hey, something that happens in the back end. My interaction with the payer is about my premiums, what do I sign, my ID card, and that's about it. I call them, I get questions. So really a cutting edge platform that can look at claims as a token of trust, like I mentioned earlier, is the only way for payers to differentiate who does it really well, who's fast at it, who's good and consistently accurate with claims processing, and who's able to explain it, because things can go wrong, right? End of the day, these systems are for humans, right? Anything can happen, but when things do go wrong, or we feel like, hey, something did not play out the way I expected to, we should be able to explain it. We should be able to provide the rationale, provide sort of a recovery plan, and recover quickly from those. So I think absolutely, as a regional player, it becomes even more important as we face local competition, is to be able to demonstrate that and then position us for sort of in the national scape as we work with other blues and national players.
Thank you. And I think we have time for one last question. So this one will be from Mark. From a leadership standpoint, how do you prepare both IT and operations for AI adoption? They're working day to day, very hardworking on, getting through their tasks. How do you make sure that it strengthens organizational performance rather than destabilizes the work that's already going on?
Yeah, and I'm going to go back to one of the things I mentioned before. It is change management is the key there. Make sure that your team understands the why and feels like they're part of the solution. That's really critical. It's amazing how many times we'll go in and meet with some of our largest critics for change, and ultimately they become our biggest champions after they've been involved in the change management process. In addition to that, I would say, again, making sure you have alignment on governance and the blueprint that you've put together, as we've talked about a couple of times, evaluating solutions that can meet you where you're at today, but also grow with you long term. And then ultimately know that your business is constantly changing. So you can't just automate today and forget about it in 3 years and say, oh, now we've got to take a look at it again. You should be consistently and constantly looking for opportunities to really optimize things further. So it's a constant improvement overall.
Wonderful. Well, that is all the time that we have for today. I want to thank all three of you for the excellent insights that you've provided related to this topic. I think the audience has a lot to take home and consider going forward. So I want to thank each of you for your time. And for our audience, I want to thank you for watching and remind you that this session is available on demand within 24 hours. We look forward to seeing you next time and wish you a good rest of your day. Thank you.